It was a Saturday morning. I was going to visit my parents in San Francisco, and I was going to catch BART. I was a perfectly healthy person, and I exercised, and I had no idea I was at risk of having a sudden cardiac arrest. This is not something that ever had gone through my mind. I ran up a flight of stairs to get to the train as quickly as I could. And when I got to the platform, my heart kept going faster and faster and faster and just wouldn't slow down. I realized also that I was gonna faint. And when I regained consciousness, I realized that I was on the floor, I was on the ground. Everything for me changed that day. I had no idea I had any cardiac issues, completely unexpected. And so I had to go through a couple of misdiagnoses before actually getting a proper diagnosis of hypertrophic cardiomyopathy. A lot of times the first symptom is a sudden cardiac arrest, so people don't really have a chance. What I have is an implantable cardioverter defibrillator, a device that delivers a shock to the heart in case the heart goes into ventricular tachycardia or ventricular fibrillation. I didn't know anything about the heart when this all started. I knew the heart had 4 chambers. But all of a sudden, this entire world opened up to me of having a heart condition, and I realized that in order to survive, I had to learn. And I had to learn as much as I could so that I could have educated conversations with my physician, with my doctor. Patients have to participate. You know, if patients want to be included, patients also have to step up to the plate. I hope to have full access, unrestricted access to the data that my device collects about my body, online, on my mobile devices, so that I can know as much as the device knows about my heart. To be empowered, truly empowered, to make some of these decisions that impact my life. A lot of times patients are not trusted to care for themselves. You manage your career, you're capable of managing your finances. Why is it any different when it comes to healthcare? I don't want to become a cardiologist. I don't have any ambitions to understand everything that there is to know about the heart and every possible type of cardiomyopathy. But I want to be an expert in what it comes to me, my own condition.
Hi, I'm Dr. Larry Chu. I'm Associate Professor of Anesthesia here at Stanford University, and I'm Executive Director of the Stanford Medicine X Conference. It's a pleasure for me to be here today and speak to you as part of your course with Dr. Rivas. And what I want to speak to you about is putting the patient at the center of care and putting the patient at the center of innovation, especially in mobile health and health information technologies. So the video that you just saw of Hugo Campos shines a great light on the concept of an e-patient or an empowered patient, which is a patient who is engaged in participating in their own care with the healthcare provider. At Medicine X, we really view the patient as one of the most underutilized resources in healthcare. And so our conference, which is held every year at Stanford, aims to shine a light at emerging technology in medicine with the patient at the center and focus. Our conference this year runs September 27th to 29th, and I do encourage you to check out our program and the speakers that we have scheduled for this year's conference. Part of the philosophy of Medicine X is to give 10% of the seats away to patients so that they can be active participants and partners with us in the conference, so that we can understand from their perspective how to incorporate their advice, their wisdom into the design and application of health information technology with the goal to innovate healthcare. Now, one of the very interesting things about Hugo's story is his search for really understanding himself and his own health by gaining access to data that is recorded by mobile devices, in this case an AICD defibrillator device that's actually implanted in his body. But his story doesn't end there. A few months ago, Hugo was sitting at home in front of his computer, and he began to feel fluttering in his chest. Now, in this instance, he actually uh, didn't have access to the device that's in his chest to see what was going on, but he did have an Alive Core single lead ECG device that plugged into his iPhone. And he was able to use that device to record a rhythm that his heart was producing at the moment he was having those symptoms. And he was able to tweet that rhythm and share it with the world, and more importantly, with electrophysiologists and cardiologists that were following him on Twitter and for which he had already had previous discussions and dialogue with through social media about his condition. And through those social media interactions, he was really able to start a conversation and get even an initial reading on the tracing to help him understand better how that fit within the context of the symptoms that he was having. And I think really Hugo, in my mind, is just one of the many e-patients out there who are redefining healthcare for us, redefining our thinking of how technology can be used to redefine the doctor-patient relationship. And so I use Hugo as an example of someone who's really thinking creatively about how we can use technology to best innovate healthcare. One of the things that I want you to think about throughout the work that you do in this course is how can you remember and focus on the patient and place the patient at the center of your work, whatever that might be. There are several great resources that I really recommend that you look into. The first being the Society for Participatory Medicine. If there's one thing that you do, I really encourage you to go to the Society for Participatory Medicine's website, to use them as a resource, to become a member, because by being a member of the Society for Participatory Medicine, you're beginning to engage with engaged patients, e-patients, healthcare providers who are forward-thinking about re-engineering the doctor-patient relationship to be one of partnership, to work together, and to end this era of paternalistic medicine where it's a one-way conversation that the patient is supposed to follow a doctor's orders. What technology, what mobile health can do is to create a new dynamic where the patient's a partner with the healthcare team with their overall goal of improving their health. Now, if you do research, some of the other organizations that I want you to be aware of is PCORI, Patient-Centered Outcomes Research Institute, which is a federal institute that exists for you bringing together patients and researchers together to start solving some of these problems and invigorating the research process by using patients as a resource. I also want you to be aware of AHRQ, or the Agency for Healthcare Research Quality. They're going to be they're always announcing different program announcements, and you should always check their website to see if any of these funding opportunities fit within the scope of what you want to do. But patient-centered care and projects that center around the patient are definitely becoming increasingly important to that agency, and there are many opportunities there to get funding and advice and information about how you can use patients, the most in my opinion, the most underutilized resource in healthcare, to improve your work and to give your vision the focus that it needs. So thanks so much for watching this video, for giving me an opportunity to speak to you about keeping the patient at the center of what you do. And I look forward to seeing you at Stanford Medicine X in the fall, September 27th to 29th, where you can really have an opportunity to meet the thought leaders and innovators in the fields of emerging technology in medicine and patient-centered care. Thanks so much.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.